I don't know if everybody knows my story, but I've been with Channel 2 for 32 years now. I started when I was 7. And I've been the health reporter the whole time that I've been there. All news, but also health was my specialty. And a few years ago, they asked me to get a mammogram to show how easy it is, because Utah women we were the second lowest in the country for getting mammograms, even with insurance. So it's like, tell them how easy it is. We can do this. And that mammogram, I did the story, put it on the air, and that mammogram found a tumor. And I ended up having surgery, chemo, and radiation, and I did it all on the air, just to give people a feel for, that's why Mom was sick when she had chemo. That's why we do this. And did wig shopping and tried to make it normal so we could talk about it and talk about early detection, not just for breast cancer, but for all health issues. Early detection, you have a better chance of fixing everything and getting better. So hopefully we can do that. And that's why I'm thrilled that we're doing this conference too, because it's talking about it. And I think Utah women, we're bad at getting mammograms because you don't talk about boobs. That's private. You don't talk about stuff like that, and you need to talk about things in order to solve problems. And that's why I'm really glad that we're here. But I'm 11 years from diagnosis now and still doing great. And mine was triple negative, so it wasn't the hormone treatment. It's rare, and they had to be aggressive with chemo. But I had lumpectomy, so I didn't have to have any major reconstruction. And I think most women are lopsided anyway, so I just feel like I'm normal. Now everybody's going to be looking and judging. But I've noticed with this blouse, it starts hanging over that way. So it just emphasizes the lopside, I guess. Do we have microphones for everybody, or are we going to share, Allie? I didn't know if you... Oh, okay. Okay, so we'll start just by introductions. We have just your name and that you're survivors, but we'll start with you, Joni.
I'm Joni. And what do you... what am I
Just tell them your diagnosis and why you're here.
Well, I was diagnosed when I was 63, and I had a mastectomy on... is this my left side? Yeah. On my left side, and I chose not to have reconstruction. And the initial reason was I was scared. They told me I had to go to a plastic surgeon, and I just wanted that cancer out of me. So I said, no, I don't want to do reconstruction. I have very small breasts, so it didn't really, you couldn't really tell. And my husband was fine with it. And we have a great relationship. And it wasn't a big deal to me. But if you were a younger woman, you weren't 63, you might make a different choice. If you had larger breasts, you might make a different choice. So that was the reason I made the choice. I've never been sorry, other than I wish they'd taken the other one, so I'd never had to have another mammogram.
So I'm Elizabeth. I am from Brazil. I was diagnosed, I was 50, about 4 years ago. And they got it very early, so thank goodness. It was in situ, but I didn't need any treatment. But because I knew my brain, and then after that day, I want to have an MRI every week, I decided to go with a double mastectomy and reconstruction, because I couldn't see myself flat. I was scared. Today, after my reconstruction journey, I don't know that I will reconstruct again. And I don't know. Anyway, so I had a bad luck with the plastic surgeon that did my reconstruction. It was completely asymmetrical. I could not move my arms. He grabbed my muscles underarm. So it took me about 3 years to be able to find another plastic surgeon that could fix. And now I just learned that this side flipped. So I'm gonna have to have another surgery. So I had five surgeries in 8 months, so my body was completely wrecked. Anyway, so that's my story, but I'm happy with what I have right now.
Hello, my name is Tara Pennington. I was diagnosed not even a year ago, Friday the 13th, last May, so almost a year. And I was stage 1. They caught it early. I opted for a lumpectomy and radiation. I'm here today because I am a mental health therapist, and I have decided to turn pain into passion and work with individuals that have had or do have cancer to help others to empower them with their sexual health and body image.
Okay, I'm Anna Jensen. I was diagnosed at 39, stage 3 HER2 positive cancer, 2 days before my daughter's 16th birthday, and no family history, didn't know anybody with cancer. So I was navigating this by myself, and also hid it from my family until I had to go and get my chemo port in the day before I told them. I had chemo, bilateral skin-sparing mastectomy, radiation, and then I had my DIEP 12 months after radiation. Image Reborn was important to me to allow myself and give myself permission to not be okay. I was always the strong one, doing everything. And now I volunteer since 2016.
Hello again, everyone. My name is Camille Moreno. I'm with University of Utah OBGYN. I am a midlife women's health specialist, but more importantly, a sexual health advocate, and very inspired by everyone here and also the stories I'm hearing. So thank you for the opportunity.
And I'm Jordan Rulo. I'm a clinical health psychologist, a certified sex therapist, and a couples therapist. And I worked at a hospital for years, working with cancer survivors and sexual health, and realized this is just such an area that is so ignored and needs more advocates. So I'm just so happy to be here. Thank you all for being here too.
Hello, again, I'm Natasha Fett. I'm a doctor of physical therapy. I specialize in orthopedic, sport, and pelvic physical therapy. I treat mostly women, and I am very passionate about issues unique to women and the fact that we are still a somewhat underserved population. So I am so grateful to be here, and thanks for having me.
Oh, just a pleasure to be with you again. You look great.
And we know why Dr. Saltz is here. And he hates it when I explain why he started, how he explains why he started Image Reborn. And he explained his story very well, but he always says he can fix women physically, but it was emotionally. And every time he says physically, he says physically. just a loving gesture. But we know our stories. I'm always in trouble. We know our stories, and if you want to share now, or if you have any questions for anyone up here, feel free now. Allie will run over with the microphone so we know that the people watching online will be able to hear the question and get the answers. If you have any questions about why there were decisions, about intimacy, about any other, we have the solutions that we've been hearing today have been fantastic. So if you do have any questions, feel free now. And everybody said they'll be honest and open about their answers and solutions. Go ahead.
Question for Dr. Moreno, is that how you say it? How do you feel about hormone replacement therapy, so like the pellets that they can inject. How do you feel about that?
Wow, that's a loaded question to start off this panel. I am not a big fan of non-regulated, non-FDA approved hormone pellet therapy. And just to provide a brief background on what that is. So it is not a typical prescription that you would get at Walgreens, CVS, or Smith's. You go to a hormone clinic, a bioidentical hormone clinic, and they offer you compounded either hormone therapy that's used topically or vaginally, but also these injections or pellets that get absorbed through your subcutaneous fat in the gluteal or buttock, so butt region. The evidence behind pellet therapy really has shown that it's scary. It leads to really high levels of testosterone in your bloodstream, more than your male partner. So it can cause increased clitoral size or clitoromegaly, hair thinning, acne, voice changes, so deeper voice. And I've seen levels up to 400, 500, unfortunately, and it takes a while for those levels to come down. The pellets take about 3 to 4 months to absorb. And so, again, it's not FDA approved. I know that it's very popular in this state. And I've seen 2 to 3 cases in the last 3 years or so where it can actually affect your conduction system of your heart and lead to atrial fibrillation or AFib. So again, it's a discussion, just like what I've been focusing on. You have options, but there are safer and effective options. You're welcome.
Anybody else want to weigh in on that? Has anybody tried this or had any? Okay. No, thank you. Thank you. Great question.
I actually have 2 questions for Dr. Saltz. You had mentioned sensation with nipple reconstruction. I have no feeling, so how is that? I just want to know more about that. And then the second one was, I did the DIEP flap, and my scars are kind of high. And I always joke that I have a smiley face. I have 2 circles, a nose where my belly button is, and a big smile, the way my doctor described it, tabletop to tabletop. But when I wear a bathing suit, these ones are hard to hide. Is there anything that I can do to lessen those scars?
Good questions. How long ago was your reconstruction?
3 or 4 years.
3 or 4. Because usually it takes about a year for the scars to mature, the color to fade. There are great things now one, if the scars are too wide, your surgeon can always reduce them, because that initial tension that the tissues had usually pulls them apart and the body tries to heal. So if after 1 year the scar is too wide, you can narrow it. If the scar is too red, all after 6 months or a year, if the scars are too red or too hyperpigmented, there's some excellent lasers now that can really bring it down to a more natural color. If the scar is hypertrophic, or not a keloid, but like a keloid, a hypertrophic scar, which some people just heal like that, you can use silicone tape, applies pressure, or daily rubbing, daily massage with some lotion or Vaseline. Don't spend your money on this fancy ointments and treatments, because all it takes is some skin lotion. It will do the same thing. And the latest thing we're seeing is with microneedling. Microneedling is now part of many med spas and things. And what it does, it creates enough trauma that generates a lot of blood supply, and it helps to, foster healing in that scar. So you have the options of revision, surgical revision, and all these other things. The second one is a tough one. So there's been a lot of developments in nerve regeneration and nerve like a transplant, bringing nerves that will revascularize the nipple and connect to some other nerves in your chest for more sensitivity. Usually those techniques are done during the reconstruction. It's harder if you already had a reconstruction that was not focused on nipple sensitivity to have sensitivity there.
Okay. And being 3 or 4 years out from the reconstruction, that's not too late to try to get the coloring down and the...
Not at all, not at all.
Thank you.
I can talk about nipple sensitivity from personal experience. So I'm probably about 6, 7 years out from my DIP, but I have noticed like sensation coming back, but it's not a direct stimulation. I notice like my neck or the back, or if my husband's playing there, then I will get sensitivity or stimulation in my chest.
Hello, my name is Gabi Portugal, and I am the director of the cancer programs at Alliance Community Services. We have a survivors group from Hispanic survivors, not only breast cancer, but many other cancers. My question goes to Tara and Elizabeth. How important is mental health in finding the support of culturally sensitive groups? The survivorship is very important. We in the group mention it very often because it's not the person, it's the whole family system who gets to survive the disease. Where have you found the most valuable support after diagnosis?
In my experience, because I am fairly new to this, I have several clients who are in the Hispanic culture, and they're finding a lot of support through social media. I would love to connect with you and learn more about that. The cultural aspect has been really eye-opening for me to learn as well throughout the years of just being a therapist in general. But to answer your question, in my experience so far, my nonprofit that I helped co-found is doing a lot of social prescribing now. And so if anybody has more resources for me as well, please, I'd love to connect with you after. As far as I think social media is a huge platform, and I think it's an amazing way to connect with other organizations. And so my clients who are of other cultures or races or ethnicities are finding support through Instagram and Facebook support groups and word of mouth. You're right, the family dynamic is huge in that. I'd be interested in hearing what you have to say about that as well. Which Elizabeth are we talking? You, me, or you?
Thank you. No, I wasn't sure. So I guess for me, I think first and foremost was my husband, and then my kids. I guess that was everything that was there to support me. I don't know if it is a Brazilian type of thing, but if it is me, but I talk. And so I guess has to do with our culture, right? We talk. And so I talked at work, I talked with friends, I talked. And that led me to resources, like, the retreat was by talking that I got there. And also, to me, affect a lot my self-esteem, especially because it was so messed up. So I would not take I am LDS, I wear garments. I will not take my garments forever, even during sex. I will not take my top off at all. I went to Brazil, and to wear a swimming suit was a struggle. And so I had to, also, I needed to rely on some therapy. I needed some therapy too. So I did quite a few of them, but the one that really did the trick was the hypnosis. that was the best for me. But my entire family and everybody, even my family in Brazil, was my source.
Thank you. Great question. And we also have Image Reborn Spanish-speaking retreats. And we actually also have retreats for deaf starting up this year as well. So better ways to communicate. And that's been a huge support system for, like Dr. Salt said, 4,000 women so far. And Image Reborn, it is a bonding that you get. How many of you have been to an Image Reborn retreat? Okay, it's good to see so many, and now everybody else knows about it too. So it's a great resource for support, emotional support.
Okay, my question is for Dr. Moreno and anyone else who wants to chime in. I was diagnosed a year ago with stage 1 breast cancer and needed a lumpectomy. However, prior to that, I was seen by an oncologist for quote-unquote bad ovaries. When my ovaries were removed because they said, oh, they might become cancerous, I was diagnosed with virilization, which is an enlarged clitoris, and an extremely high level of testosterone with no history of cancer. So my ovaries were removed, and the doctor promised me that, oh, everything's going to go back to the way it was. And in the 4 years after that surgery to remove my ovaries, it didn't change. Then last February of 22, I was diagnosed with breast cancer. And I had been putting in, inserting estradiol because the oncologist in another state said, oh, you need to have this now. Now that you don't have ovaries, you need to keep yourself lubed up. Well, I stopped the estradiol thinking, oh, maybe that's going to help. Endocrinologist said, oh, that'll help. Okay, blah, blah, blah. Fast forward, my question now is, with the vaginal dryness, and anyone can respond, I now use what another oncologist gave me, which is a sample called, a medication called Reverie. It's an OTC, which is a hyaluronic acid. So I'd like your response on what you think about this. It's a suppository that you can buy it over the counter through their website, but it's not a medically prescribed supplement. So I'd like a response on what you think of that.
Yeah, so thank you for bringing that up. What a very complex history, and I'm sure it was an emotional kind of roller coaster ride that still led to the same kind of symptom, which is dryness and and all the other symptoms that are associated with it. But Reverie doesn't need a prescription. It's actually considered one of those vaginal pH moisturizers that increase moisture lubrication to the vaginal and vulvar tissues. Hyalogine is similar to Reverie, so it's made up of hyaluronic acid. And as we know, with hyaluronic acid in joints, it acts pretty much like, has the same mechanism of action for the vaginal tissues, which is to hydrate and to decrease that friction. And like what you mentioned, you don't need a prescription. It is an option, especially for those who I would say have overall milder symptoms, and using it consistently really will help. But even those who are also on vaginal estrogen products, you may use these vaginal pH moisturizers as adjunct or in addition to your estrogen products as well. But it overall supports, I would say, or it helps soothe symptoms, but it doesn't change the overall tissue composition, and it won't change tissue appearance, but overall can help pain, dryness. And with your history, I would understand why you would pick a vaginal pH moisturizer versus a vaginal estrogen product.
Can I just comment what I am doing now, because it changed my life a month ago. And I got into menopause, forced menopause, 5 months before my diagnosis. So I had to remove my ovaries 5 months before. There was a tumor, a benign tumor, but they took it out, and the doctor told me, "You're gonna curse me tomorrow morning. You're gonna hate me because you're gonna go into menopause as soon as you wake up." And all the symptoms. So it was horrible, horrible, horrible. The night sweats and the hot flashes, and I would cry in the morning, kill somebody at night. It was really, really, really bad. And so I was not suicidal, but I told my oncologist, I don't want to live like this. And sex, not even think about it, don't even get close to me. There is no libido at all, no desire at all. And I don't know who of the doctors, the presentation that you guys did that said, I can live without sex. I don't even think about it, that was me. And then about a year ago, they finally let me do some hormone replacement. So I have the patch with very little estrogen. They let me do the cream, the vaginal cream, very small dose. Then finally they sent me to a sex, I don't know how is it called, a sex doctor, I don't know how is it called, but a person that is specialized in sex. And so she gave me this called Intra-Rosa, and I've been using for a month. And she also prescribed a manipulated testosterone a little bit, very little, and that has changed. I can think about sex now, I can even enjoy now, and it changes completely. So I think if we can advocate to have the hormone replacement, even if it's a little bit, that changes our lives, at least changed mine.
And some of those sounded familiar, is that right, Dr. Moreno? Mm-hmm. Yeah.
Yeah, so the vaginal DHEA is Intra-Rosa or Prasterone out on the market, and that is FDA approved. It is a vaginal suppository that you would use every night. And not estrogen, not testosterone, but there is a role in adding topical, off-label therapy, topical testosterone to help with sexual dysfunction, low libido, arousal, orgasm. But again, takes a conversation with your healthcare provider. But I would have to agree with you. I think, I think healthcare providers, we have our special niches, right? We have our special interests. And unless we're educating ourselves consistently, staying up to date on the evidence, then we kind of know a lot more about it. And not everyone's going to be on the same kind of, playing field. So I do think that, seeking out sexual medicine experts, through the websites, through ASECT, through ISHWISH, really does make a difference through NAMS because they have a better kind of comprehensive approach to addressing your symptoms.
So the solution came from, first of all, talking about it, because you're a good talker, and seeing experts, OBGYN and a sex therapist, to come up with the right solution for you. Fight insurance, yeah. Ask questions. Get all your doctors on your side, too. Now I want to ask Bobby, you're in contact with some of our friends at home, people online. Any questions? Oh, I'll do this.
Okay, I have had several questions for Dr. Moreno. One is, will using moisturizers regularly have any long-term benefit if you're not having penetrative sex?
Yes, it does. I think I always say, even if you join the nunnery, but you have a vagina, you deserve vaginal pH moisturizers, even if you're not using it. And the reason why, again, it hydrates the tissues, right? It helps with the dryness. You don't have to experience pain just with intercourse. There's pain even without intercourse, and the best description that I've heard, it's like literally shards of glass that I'm feeling on my vulva in the vagina while I'm sitting or doing yoga because of my tight yoga pants. And so even with that alone, without a partner, you don't have to be sexually active. You can safely use vaginal pH moisturizers consistently.
Another one I have is there a time when it's too late to turn things around? This is also for Dr. Moreno.
I'm a half glass full person. There's always the time and there's always that conversation, and I really don't think it's ever too late. But I do want to bring up that, genitourinary symptoms related to menopause, whether surgical menopause, natural menopause, is because, or the treatment that you're on, those symptoms progressively get worse without anything. And so you are not alone. You should not be suffering for years before even asking for help, because there are options out there, whether it's hormonal or non-hormonal. But without treatment, the symptoms do get worse.
Thank you. Okay, another person asked if you or if anyone has any thoughts on using numbing products such as lidocaine, cloves, and things like that.
Well, you can tell the medical stuff. I can tell the psychological. Okay.
I do prescribe, you don't really need a prescription anymore for lidocaine jelly. It's found over the counter. And I do prescribe or offer or recommend lidocaine as a topical or local kind of jelly anesthetic. You don't inject yourself, you just apply that solution on the vulva a few minutes before intercourse, maybe 5 to 6 minutes before, because that's what the studies show. And it could be, and this is where the data is mixed, it could be, just that reassurance, that this is a barrier that may help, with the penetrative pain. But it also has some effects where it also decreases the pain receptors and the stimulation of the pain receptors. We actually use this as well as a numbing agent before you get an IUD. So we place this on the cervix as well. When I do vulvar biopsies in clinic, I also put this on the vulva before getting that tissue diagnosis or that tissue sampling. So there is some effects, but you just have to use it, minutes before intercourse.
So the psychological piece of it is it's numbing. It's a numbing cream. So if things are numb, that means not only are you not feeling the pain, but you're also not feeling much of the pleasure. So it may be helpful to return to sexual activity, but it's really going to impact the pleasure piece. And then there is some trial and error. I've had clients I've worked with where they've used it a little too much, and so they are quite numb, and their partner is quite numb too. So there's just going to be some trial and error. It sounds like the 5 to 6 minutes before is what the research suggests. I've had clients I've worked with where they have to put it on 15 minutes before. So just trial and error if you're going to try it out.
Okay, I have another one. The weight gain since beginning tamoxifen last summer has negatively affected my body image. To me, it's worse than the chemo, double mastectomy, and DIEP. Any weight loss tips while on this sort of drug? I've hit a brick wall.
I guess yeah.
But I would not be helpful to talk about losing weight tips. But yeah, there's the body image piece. If losing weight is not an option at this time, then it might be working on mindfulness to just come to some level of acceptance is, okay, this is where I'm at right now, versus using all of that cognitive energy to battle and try to be different or make it not this way. It's just, okay, it is this way right now. I talked about that continuum of not having it be negative. It's going to be too hard to probably jump to the positive, so can it just be neutral right now?
Okay, go.
Hi. Just before I ask my question, if you can connect me with that person, I have a food background and willing to help her on the side. Okay. My question is for Dr. Sells. I was diagnosed in 2020 with triple negative breast cancer, and I had chemo, radiation, a double mastectomy. I did delayed reconstruction throughout treatment, and I'm 1 year out from my latissimus flap reconstruction. So my question is, during that decision-making process, I wasn't a candidate for the deep version, but I was a good candidate for the latissimus, which is what I went with. However, I was so focused on making the right decision that I don't think I paid enough attention to afterwards, sort of the way of life and how it was going to affect me, and the pain that I actually have and the stiffness. I'm exactly 1 year out, so my question is, what I have today, is that it? Am I living with this sort of tight, sore pain? If I overdo it with yoga, I'm sore for 5 days. Is there a point in time that it does get better, or is that just now my new normal?
No, it does get better. What is your shoulder, what is your joint limitation? Any? Can you get your arm up?
I can, and I've gone through extensive...
So it's mostly flap related?
Yeah, and it's a lot of, it's sharp. I can get some really like sharp pains if I reach down in the wrong angle, and it's just, there's no rhyme or reason. Some days are better than than others, but I'm at a point where I'm thinking this is the most frustrating part, because this is what reminds me of this chapter more than anything else.
So, and I'm sure you can help. Natasha can give you some. What I tell my patients is massage, massage, massage. Break all that scar tissue. That latissimus came through a tunnel from the back to the front. That tunnel has been created, was never there. So you have a tunnel of scar now. It takes time. Yes, it's going to get better, but you cannot just sit there and wait. The good news is you have an excellent range of motion. Sometimes the limitation is like, I can't get my arm up here because of radiation. Those patients are miserable because they just can't perform anything. So there are many ways to soften that up. I'm sure she can help you. But just basic rubbing, get blood supply to those tissues. Yes, it does get better.
Okay, thank you.
I have a quick question for you. Have you tried physical therapy?
Oh yeah, I've done it all.
Yeah. Okay.
And weekly massages. So I think I've fallen off the wagon on the massage self-care side of things. So I think I'll go back to the weekly side, because it does make a difference for sure. Yeah.
Sorry, I had to stretch for a second.
I have a question.
I still have some neuropathy in my butt. So if I stand for a long time, I have to move a little bit and get circulating blood in there. So it's not painful neuropathy, so that's the good thing. But you guys made my butt go numb. So Dr. Saltz, you wanted to add something?
I have a question. Yeah, and Rulo?
Yeah, for Jordan.
So one of my frustration was we could never get many of the spouses involved. We actually, many years ago, in the late 90s, when we first started, I had a retreat with the women and their spouses, and it was a total fiasco. The men would never get involved. They actually end up in another room, and I kept running back and forth, and it's been very frustrating many years doing this, how many of them just disappear, rates of divorce and total. So I was very reassured when Ms. Lopez mentioned that she had a lot of support at home, but that's not true in many situations. So what do you tell breast cancer survivors? How do you get those men more involved? And I understand the reasons, and is there a role for Image Reborn to try that again? Maybe that was 20 years ago. Maybe men are more aware, men are better now. I don't think so, but give us some hints.
Yeah. So part of it, I'll do my best to answer that question in a moment, but part of a spouse not being involved, I think part of that's the fear. Like, what do you say to your partner? You're watching them going through all of this pain and being poked and prodded, and like if you have difficulty talking about emotions, like how do you talk with your partner and support them? A lot of partners don't know how to support their partner going through breast cancer. So that's one piece. And then let's add the sexual health piece. So many couples don't talk about sex. They'll do it, but they won't talk about it because we don't get sex education, or many of us didn't. We don't learn how to talk about sex. It really is a skill. There's so much taboo around it. So emotions can be difficult to talk about, and then sex can be really difficult to talk about. So now here's this topic that is not being talked about, which then can fuel a partner not engaging and supporting. So I would say if you have a male partner, there's a really good book called Breast Cancer Husband. And it's a little bit of an older book, but it would be like, buy it on Amazon and just like leave it on the kitchen table. Just to get the conversation started, because the first step is really going to be communication. And your partner might be sitting back saying like, well, she'll tell me what she needs. When she needs something, she'll let me know. And you may not even know what you need. So part of the conversation may be like, I don't know what I need. I'm scared. You're scared. Like, let's just talk about this. We don't know. We're navigating this together. So I cannot stress enough communication. And then, going back to your question, how do we get partners more involved? I think if you're opening up the door, if you're communicating, if you're reading that book together, that can maybe be like, hey, I don't know what I need, but I do want you to come with me to this. One of the first things, it's interesting you brought that up, when I walked in the door here, I thought, I don't know if I see any spouses here. Not that spouses are going to be men, spouses can be women, so maybe there are some women spouses here, but I was like, where are the spouses? Because it would be great if they were here. So communication, some reading, and I think you can't force your partner to come, but you can sure let them know you're scared, and it would be really helpful if they came with you to your visits or to your appointments or to these conferences.
Yeah, and talk, and we're going to go to the talker now.
But I just had to say one more thing, though. I don't think also, I don't know, my husband is not the best man in the world, no. But also, I had to become very vulnerable and telling him, I cannot do this now, or it doesn't work for me this way, or now I can't. Get out of my face. I cannot even look at you. So, and having these opportunities, and just say it. And I think to me, that was it, to tell him that I could not deal with other stuff. He needed to jump in and do some other things. I needed my moment. So being able to also not think that I had to do everything and I need to take care of everything and I need to be stronger the entire time. I think that was important as well for how we dealt with it.
And I think sometimes everybody's so overwhelmed at the beginning that you jump and make these decisions. This surgery, because get it out, And I've compared it to giving birth, but at least giving birth, you get something good out of it, right? But with getting cancer out, you're getting something good out of it too. You're getting more life. So to fight through it, but also the talking. And I use cancer as an excuse for a lot of things, and they're usually very willing to listen. I mean, it's not me. It's not that I don't like you. It's that the treatment did this to me, and it's causing this. And if you can explain it, if it's been explained to you, like we've been hearing today, it's easier to explain to someone else why this is going on and what's happening, and just being honest and communicating. Oh, go ahead.
So Allie knows this, but I've been asking for a retreat with spouses able to come so that we would have our separate sessions and then come together at some point. Because your husband does not know how to support you. When I was first diagnosed, it was stage 4, but luckily it got downgraded once I had my mastectomy and everything. But here I am, trying to raise my kids, keep a full-time job, work on cancer, and I'm passing things that I used to do to my husband. Here's my passwords. Here's how you pay the bills. Here's this, here's that. I'm purging stuff so he doesn't have to go through and clean out my stuff. So there is no support for them as to how to support us or what to expect when we're going through things, the surgeries, the unknown. And I didn't have family, so I didn't know what my cancer journey was going to look like. So, he went into alcoholism,
So now I'm dealing with cancer and alcoholism. And he's gotten help for that, and we're a lot better now. But it could have been easy for us to just throw in the towel and separate. But being together for 30 years, you don't want to throw that away. But I think had there been support for the men in our lives, a lot of our relationships would turn out differently after cancer.
I think a big part of that too is that initial diagnosis. And when you get the word and when you go to your first appointment with or without him, who's with you, who's your support system. Every cancer is different. Even every breast cancer is different because every person's different. Every family support is different. Every emotional issue is different. And I remember when it was a week before starting chemo, and I had 2 different people sit me down and say, okay, this is gonna happen. Your hair's gonna fall out on day 11. You're never gonna be able to eat chicken again. Don't ever eat at your favorite restaurant after getting chemo because you won't ever be able to eat it again. And telling me what's gonna happen to me, and I'm like, and I was fighting it the whole time, saying, no, what if I'm different? I didn't say it out loud, but I'm like, oh, okay, thanks. It's gonna suck, I know that. But it didn't happen to me that way because I'm different. I'm a little bit younger or a little bit taller or with my emotional support, I was faking everybody out, including myself. I kept saying, I'm fine. Oh, my husband would say, what can I do? What can I get you? How are you feeling? Oh, I'm fine. I'm fine. Get up and go to work. Get up and go to work. I'm fine. And at 3 years with triple negative, it's at 3 instead of 5. Where the risk of recurrence is lower or done. And my oncologist said, your treatment worked. I was a wreck, because that day I realized I had been scared every single day, and I'd been faking myself out. Because I said, I can do it. I missed 4 days of work in the year of treatment because I faked it. I joke, fake it till you make it. But I'd get up and go to work, and I was green and looked horrible, but people still watched me on TV. But I made it. And I didn't realize that I had been faking it the whole time. But I got through 3 years of not being scared, and then it all came out in one day. But everybody deals with it differently to get through it.
I think that's the reason I decided to go into trauma work with my clients is because I realized that after my radiation and I was done, that's when my trauma started. And I realized even as a therapist, I didn't properly take care of my own emotions and my own self. And I've been doing EMDR with clients that have cancer that has really helped the trauma part of it because you're in survival mode and all of a sudden it's done and I'm sure everybody knows you cannot quite express what happens at that moment when you realize that, oh, now I'm going to deal with everything. So thank you for sharing.
But then you throw in intimacy, and it's another person, and totally different mental health, totally different physical, totally different upbringing, and their family support system. So how do you get 2 people with totally different things all to be the one answer? And it really isn't. There really isn't one answer.
Mary, we just have one more question. And I know there's more questions, but we have 2 minutes. So I just wanted to allow one more person to ask a question. And then before everyone disperses, because I know that this room is going to be taken away from us, I just wanted to let you know that you're welcome to mingle and meet outside of this auditorium if you'd like to stay and talk to any new friends that you've met. And thank you to all of our panelists.
Dr. Moreno, I'm 66, single, on tamoxifen, no symptoms that need to be treated or else they'll get worse, except 0 libido, and I don't care. And so my question is there any physical or health benefit to maintaining sexual activity after whatever age or life circumstances you're in?
First of all, you're not 66. Yeah. Okay, you're gorgeous.
Yeah, so that's a great question. And yes, there is an importance. It definitely a long-term, I would say, way to looking at this would be, I have this organ, right? I have a vagina, even if we're not using it currently at the moment. Again, it still is important for other health, concerns, right? Because you can still have the dryness, you can still have the pain, you can increase your risk of urinary tract infections as well with loss of estrogen, being on tamoxifen, which is an anti-estrogen blocker. So yes, there's an importance, and the reason for that is because without that stimulation, and whether, again, it's with masturbation, whether it's with using a dilator, whether you're seeing a pelvic floor physical therapy, there's a role in maintaining the width, the tone, as well as the tissue itself. So without addressing all of those components, that will lead to symptoms, whether it's tamoxifen related or natural aging related, or again, just being menopausal.
Outside of my vagina, is there any other part of my body that benefits from sexual activity?
Yeah, so that's, I do think, I guess looking at it from the perspective of checking and looking and being aware that, again, the vaginal and vulvar tissues change over time. So appearance may be changing, but because of a normal or natural transition, or you may are experiencing these changes because of what you've been through. I would say the tissue versus stimulation matter more, if that makes sense. So hopefully that's not as confusing. So, because when the tissue starts changing, becoming atrophic, so again, less lubricated, more dry, more pale, that's where the symptoms start to happen.
Can I add a piece there? Yeah, sure. And there's good research showing that orgasms help reduce headache. They help with pain. There's some research suggesting that frequent orgasms help with the immune system. So I'm like, an orgasm now and again could be nice just for your overall physical health. Mental health-wise, though, if you don't feel like you're missing sex, then it's not worth pressuring yourself or thinking I should be doing this or what's wrong with me. Or if mentally just feels like, yeah, I feel fine with where I'm at sexually, then mental health-wise, like there's no concern as long as you're good with it.
Well, it's fascinating to listen to everything today, but I sure think that sounds like a lot of work.
So before we go, I just want to acknowledge again the work that Bobby and Allie and Erin have done for this event. But also, there's no foundation without a board, and we have 3 great representatives of our board of directors. Of course, Mary Amazing Nichols. We have Karen Gunter, who's actually my PA, fantastic. And we have Rebecca in the back. So thank you for being so supportive.
Okay, and Allie just wanted me to remind you that this whole day, the whole conference is recorded, and you will all be getting a copy of it. So if you had any questions or anything like that, you'll be getting copies of it on your email that you registered from, and you can still ask questions. You can still directly ask questions to Image Reborn, and they'll find the answers for you. If you have any friends who are involved or questions about the retreats or any of what we've heard here today. So thank you all for coming. Thank you so much.